Our picture today looks different. The direction of the pandemic has turned, and if we're careful and cautious, we can maintain this momentum. And this momentum is what gets us to a good summer. That's thanks to your work. You'll see in the data today that the numbers of cases and hospitalizations are falling. That is good news. But we need to temper this good news with the knowledge that our hospitals are still under incredible strain. Hospitalizations are decreasing, but the number of people in hospital with COVID-19 has just dropped below the peak of wave 2. And we still have a very high number of patients with COVID-19 in our intensive care units, and a high proportion of these patients remain on life support. Our hospitals remain at risk, and it's our care and caution that will bring them out of this risk. Let's talk about why we see a different picture today. Our vaccine rollout has been impressive of late. We'll show you data on that, and it is helping. And the public health measures, however taxing and frustrating, have helped stop the spread. These are measures that Ontarians have supported because you made the hard decisions to meet people only outside, to keep physical distance, to wear masks, to stay home when you're sick, and, if you're an employer, either to shut your work site when people are at risk of being sick, or if it has to remain open, to operate it safely for your employees and patrons. This is what has helped turn the curve and given vaccines time to work. So the message today is simple. The more we can vaccinate and the more that we can keep spread down by sticking to the basics that prevent transmission, the faster we will see the end of the pandemic and its associated ills. The projections we'll present today are clear. We are doing better than much of the world, but we're nowhere near yet the case counts we see in countries like the United Kingdom. The models suggest that reopening on the 2nd of June will lead to a rise in cases that will likely subside later in the summer. Waiting till the middle of June to reopen will likely bring cases down to a very low level and a consistent downward trend throughout the summer. Opening schools on the 2nd, but nothing else, takes us somewhere between these two options. These are all challenging trade-offs, and none of them are without risk. I want to emphasize that these are challenging choices. No one wants a fourth wave. We as a community will need to be careful and cautious to avoid that fourth wave. And the wild card in all of this is the variance of concern. If a new variant, particularly one that doesn't respond to vaccines, enters the province from abroad or spreads widely, we may lose control. But the fewer cases we have, the better we will be able to control new variants as they emerge. So the outlook is cautiously optimistic, but this is not a time to let down our guard. As we try to control spread, please get vaccinated. In some areas, even teenagers are eligible for vaccination now. Even if you have to wait in line or wait online, please get vaccinated. Get vaccinated, help others get vaccinated, give your employees time off to get vaccinated, and remember to come back for your second dose when you're called. And bring it outside. The weather may not be as great next week as it was this week, but if you're meeting folks, please do so outside safely. We've changed the picture. Now we need to lock in those changes. So let's get to the numbers. And my apologies, the sign language translation will disappear when we come to the slides. It will return immediately afterwards. Great. We'll start as we'd usually do on our key findings. Cases, positivity, and hospitalization rates are decreasing. Control of the pandemic is improving due to current public health measures and vaccinations. These are the efforts of Ontarians that are bringing this under control. The access to care deficit continues, but high-priority surgeries are being performed at higher rates. Maintaining progress on vaccinations and maintaining some public health measures until mid-June can help ensure a good summer. School reopening will create an increase in cases, but this may be manageable. And outdoor activities are much safer than indoor activities and should be encouraged. Let me go now to the slide we usually start with, which is the case rates, weekly new cases per 100,000 residents across public health units in Ontario. For the first time, you can see that there are fewer health units with increasing case numbers than those with decreasing numbers. The majority now are decreasing, with only a couple showing substantial increases. It's important to note at this, though, when you look at this, to note the substantial regional variation in overall case rates. So case rates are down. Positivity, number of tests that come back, the percent of tests that come back positive is also down. So when we see declining cases and a declining positivity, this suggests that this is a real decline in cases. It's important to note that testing volumes are also down. So we may be missing some cases, but when you consider cases being down, positivity being down, and hospitalization rates being down, this looks like a real reduction in cases. And just following at that point about hospitalizations being down, we thought it'd be important to show hospitalization rates in the second wave compared to this, the third wave, for some of the older age groups where we've seen substantial penetration of vaccination. You can see in the oldest age group, which is the top dark purple line, that's people over the age of 90, and the orange line underneath it, which is people between the ages of 80 and 89. You've seen a sharp decrease in the hospitalization rate per 100,000 population, and a much lower peak in this second wave. And so all of this suggests that public health measures are helping control spread, but also vaccination is helping control spread of the disease. You can see here a chart that we show every time. This is the level of patients in inpatient beds in hospital, people in hospital with COVID-19, and people in intensive care units with COVID-19 or COVID-related critical illness. You can see that hospitalizations have come down substantially over the last little while, but important to note that we are now kind of back at a point that's just below where we were at the peak of the second wave. So although they've come down, they're still at a high level. You can see the intensive care unit occupancy, the number of intensive care beds that are occupied, or the percent of intensive care beds that are occupied by patients with COVID-19 has also come down, but we expect this number to come down much more slowly than we'd expect to see with the hospitalization rate. And if you look over at the second wave, you can see that same pattern of hospitalization rates coming down quickly, intensive care unit occupancy coming down much more slowly. Moving now to the projections. I want to show 3 lines here. These are just representative lines out of the 5 different models that we run to try to understand what's happening with the progress against the pandemic. Each of these models has separate scenarios or multiple scenarios that they run. But really looking at 3 lines here. In each of these lines, we've assumed that there would be a particular date for reopening. With the red line, we've assumed that we're open right now. With the yellow line, we've assumed that we'd reopen on June 2nd. And with the green line, we'd assumed that we'd open on June 16th. With all of these as well, we've assumed that we're vaccinating about 130,000 people per day. And it's important to note that we're not considering new variants of concern. So it's hard to model variants that we might not know what they look like, so we can't actually model them here. But this assumes that there's nothing new entering the country. So as you can see here, by about mid-June, were we to reopen back to a level of contact that's similar to what we saw in March before the stay-at-home order, were we to reopen, cases come down to about 1,000 daily cases, but not much further. If we stayed in where we are right now with the current public health measures, it's about a 50% reduction off of that to about 500. There is a little bit of a surge with the reopening that then starts to flatten later in the summer. But if we are closed for 2 more remaining weeks, we estimate or we project that we'd actually be at a low and continuingly low level of cases. Were only schools to open, the line's pretty much between the yellow and the green line. Let's talk about what this means for intensive care unit occupancy. You can see, as with the last one, we tend to sit in the range there, just where we thought we'd be in terms of the modeling. What you do see is a decline in intensive care unit occupancy. I think it's important to note that these projections of intensive care unit occupancy are likely optimistic. There's lots of reasons to suspect that the decline in occupancy will be less and less steep. There's a couple of 3 reasons for this. The first is that we're seeing younger patients who tend to stay longer. We have a high proportion of patients on life support, on ventilators right now. Really, that reflects patients who are severely ill and will stay longer. And there may be repatriation of patients back into intensive care units from hospital wards who can benefit from that care. What you'll see really is that the intensive care unit occupancy does tend to decline across all scenarios. That's because we're not projecting out much farther really here than the middle of June. You'd expect, were we to see farther projections, there would be a difference between the yellow and the green line here, with the green line being lower. I want to talk now about the access to care deficit. The access to care deficit does continue to build. Instead of showing you the usual slide, though, we thought it'd be important to talk about what care is being provided. You can see here really in that red line, after the initial shock of the pandemic, the first wave last year in the spring, higher priority surgery, that's reflected by that red line, has been much more frequently performed than lower priority or lower urgency surgery. You can see while lower urgency surgery tends to be below the level that we would have seen in the previous year, higher urgency surgery tends to be above that, showing that we're prioritizing, our hospitals are prioritizing the most urgent procedures. Going on to transfers, we are still seeing a significant number of transfers, although it has come down. And were I to show you the data from today, that number has come down still. But there are still transfers as the hospitals that are most significantly affected work to cope with the pressures of the pandemic. Moving on now to vaccination. I think it's important to note there has been substantial increase in vaccination coverage across the province. As you can see, really relatively stable now, the proportion of people over the age of 80 with a vaccine, with an appointment to get vaccine, is very high. Moving to 70 to 79 as I move across the slide from left to right. 70 to 79, significant, really the majority again of patients or people in that age group have been vaccinated. And that's true as we move even towards 60 to 69 and 50 to 59. You can see that we've made progress on the 40 to 49 age group since the last briefing. And even in the under 40 age group, which is over on the far right-hand side of this chart, you can see some progress on vaccination. And as we go here, I want to point out that the hotspot strategy is working, and continued efforts are probably a key to a good summer. You can see there's a lot more green on this chart than in previous briefings. But I do want to call, which is a good sign, I do want to call out three things, though, for a particular comment. The first is in the oldest age groups, in the most hard-hit areas, so that's the upper left-hand side of this chart, the level of vaccination remains lower than in the least risky or the least hard hit by COVID. So in the hardest hit neighborhood, 73% of people over the age of 80 have gotten a vaccine. In the least hard hit, the lowest incidence of COVID-19 infections neighborhood, it's actually 87% who've gotten a vaccine. So 73 versus 87. What this suggests is that there's a need to change tactics and likely find ways to meet the people who are in these higher age groups where they are to provide greater access to vaccination. The second thing I want to note is that overall, you actually see higher vaccination rates now in the hardest hit communities than in the least hard hit communities, which is important because it actually really puts the vaccination where the impact of the disease is greatest and should have the greatest impact on how we control cases. The third thing I wanted to note is that you actually have got relatively high uptake of vaccines in a younger population in those hardest hit communities, suggesting that it's these approaches that have been taken so far have had a significant impact, and that it is possible to get younger and younger age groups vaccinated as we move through. Let me go now to the question of indoor and outdoor activities. Outdoor activities, particularly when we pay attention to ways to make them safer in terms of keeping physical distance or wearing a mask when you can't keep physical distance, are substantially safer. Data from a study early on in the pandemic suggested that the relative risk was about 20-fold lower in terms of infection outside. We think this is augmented substantially by kind of following what people have called the 2 out of 3 rule for outdoor activities. You either need to be outdoor and physically distanced, or you need to be outdoor and masked. And that substantially helps reduce the spread of COVID-19. But I think it's important to note that there are byproducts to avoid when engaging in outdoor activities. You don't want to travel between regions. this will increase the spread of the disease. You don't want to go to crowded places or where there's crowding. You don't want to carpool with people from outside of your household. You don't want to share overnight accommodations with people from outside of your household. Things like locker rooms and shared amenities that are indoor are higher risk. And dining indoors, dining with others, sharing food and drinks that way, again, higher risk. So it is possible, though, to have a safer set of activities outdoors. And just to provide some examples of this, although it's hard in some settings, local camping with your own household is safer, but camping in another region is not, and camping with other households is not safer. Basketball with masks is safer. Singles tennis is safer. Doubles tennis with masks is safer. But again, to note this, there are some structural things. The use of indoor facilities like change rooms or clubhouses or locker rooms do present a greater risk, and these structural items are important. That takes us back to the key findings. Cases, positivity, and hospitalization rates are improving. Control of the pandemic is improving, but this is still a time for great care and caution to really make sure that we avoid the fourth wave. The access to care deficit continues, but high priority surgeries are being performed at higher rates. Maintaining progress on vaccinations and maintaining some public health measures until mid-June can help ensure a good summer. School reopening will create an increase in cases. This may be manageable, at least in some regions. And outdoor activities are much safer than indoor activities and should be encouraged. And with that, I'll just go to the list of contributors to this week's briefing.